about how we can all work together to make this year's 4th of July celebration safe for all Ohioans. I'm also here today to welcome you on behalf of Prevent Blindness and the Ohio Eye Care Coalition. Founded in 1997, the Ohio Eye Care Coalition, or OECC, is a volunteer partnership of organizations that all care about eye health and safety. We care about fireworks safety because just last year there were 1,000 serious fireworks injuries to the eye. Members of the OECC include the Ohio Ophthalmological Society, the Ohio Optometric Association, Opticians Association of Ohio, the Ohio Department of Health, and Prevent Blindness. The OECC also formed another volunteer group in 1997, and I would like to recognize the OECC and the Fireworks Safety Coalition members in attendance today. We have Lois Hall from the Ohio Public Health Association. Lois, wait. Is Renee Emerson here? I'm not sure Renee made it from BSP. We have Tiffany Jameson and Cindy Bennett from the Ohio Department of Health. Why don't you give a shout out as well? We also have a board member of Prevent Blindness here, Ro Fields from Elbrands. Ro, give a shout out there. I would also like to thank Essilor of America for their partnership and support of fireworks safety. We have several presenters here today to talk about various aspects of fireworks safety, and we will open the floor to questions at the end. Our first speaker is Dr. Gary Smith, founder and director of the Center for Injury Research and Policy Institute here at Nationwide Children's Hospital. Dr. Smith has been an active researcher and advocate in the field of injury prevention for more than 30 years. Dr. Smith has conducted 2 studies of fireworks-related injuries to children here in the U.S. and another 2 outside the U.S. He's recognized as a national and international expert on this topic. Please welcome Dr. Smith, who will share his knowledge with us on this important injury problem among children. Dr. Smith.
Thank you. Good morning, everyone. Good morning. Glad to have you here. This is a conference we've done today, and I have to say we would like someday not to have to do these conferences because this is a major problem, and especially for children. As Sherry mentioned, I direct the Center for Injury Research and Policy here at Nationwide Children's Hospital, and my clinical background is I'm a pediatric emergency medicine physician, and I've worked in large pediatric emergency departments and pediatric trauma centers across the country for many years. Taking care of many injured children, including those injured by consumer fireworks. I was the lead author of the policy statement of the American Academy of Pediatrics on firework-related injuries to children. I was also the Academy's representative who worked with the National Fire Protection Association to create the Alliance Against Consumer Fireworks. That organization now includes more than 20 national medical, public health, and fire organizations. And as Sherry mentioned, I've conducted research on firework-related injuries here in the U.S. as well as abroad. So as someone that I think has spent a lot of time thinking about this, has worked in this area for a number of years, one of the most important messages that I'm going to give you today is this. There is no safe way to use backyard fireworks. Every type of legally available consumer firework has been associated with serious injury or death. In 2006, we published a national study of consumer firework-related injuries to children. The study included more than 80,000 children treated across the country in emergency departments over a 14-year period. One of the most important findings of that study was that almost 1/4 of the children were bystanders. They weren't even handling the fireworks, they were simply observers. They also disproportionately accounted for about 1/3 of those requiring admission to the hospital, which which underscores the severity of those injuries. So this tells us that simply being near someone using fireworks places children at risk of injury. And this dispels the myth that it's safe for a child to watch as the parent handles the consumer fireworks. Now, these findings agree with the previous study, our earlier study that we published on firework-related injuries. That study included more than 300 children treated in a large children's hospital emergency department over a 17-year period. That was actually in Kansas City. Injuries to that group of children were quite serious. 11% were admitted to the hospital. One child died. 5% went to the hospital after the operating room. 10% had permanent long-term injuries, including 2% that had vision loss. In that study, the injured child was a bystander 26% of the time. So that agrees with the previous study. I'll parenthetically say that other studies focusing on eye injuries show that the proportion of children who are bystanders is even much higher, and that's primarily because many of those injuries are caused by bottle rockets. One of the things we found in the second study that we did as an important finding was that in 54% of the cases, an adult was right there at the moment of injury. And I can tell you that I hear the same words every time a child comes into the emergency department with these types of injuries. The parent will say to me, "Doctor, I was standing right there. It happened so quickly, I didn't have time to react. It was too late." So what I think this really tells us and underscores again a take-home message is that it's unsafe for a child to even be with a parent who's handling the fireworks for them. And let me assure you, these are good parents. These weren't negligent parents. These parents weren't misusing the fireworks. They simply had bought the myth these products could be used safely. Now, there are many other reasons not to use fireworks, including things such as hearing loss and trauma events. These are important considerations. In summary, let me say that, one, fireworks are associated with serious injury, especially in the pediatric age group. These injuries can and often do occur to children who are bystanders, and adult supervision is not enough to prevent these injuries. In my opinion, families should enjoy the 4th of July, celebrate our nation's birthday by going to public displays conducted by professionals rather than purchase backyard fireworks for personal use. I'm now going to turn this over to Patricia Holsinger, whose life was affected by a firework tragedy.